Morning. I'm Joe Ciotola. I'm an orthopedic surgeon at Mercy Hospital in Baltimore. I'm going to talk today in this segment about hip arthritis in particular, and go through some examples of typical patient, what a patient would look like with bad hip arthritis, and solutions that we have for them. We do not know what it causes arthritis, but what it is the cartilage, the cushioning surface on the ends of the bones wears down. And it causes a lot of inflammation, pain, and stiffness for patients. It tends to occur in an older population, but we're seeing it younger and younger now. For some reason, arthritis is getting worse. And we're talking about osteoarthritis. There's inflammatory arthropathies, such as rheumatoid arthritis, that are more of an autoimmune disease and can affect patients much younger and much more severely. Solutions that we have for the hips, when the hips wear out, they're the second most common joint to become arthritic behind the knees. And solutions for them that we start with are non-operative therapies. We know that excessive weight hurts by adding pressure to the joint. Although it doesn't cause the arthritis, it does seem to make the symptoms worse. So we counsel the patients about losing weight. We encourage them to stay as active as they can, but sometimes too much activity, too much therapy can actually make them hurt worse. So we always gauge that on a patient-by-patient basis. Anti-inflammatory medications such as Advil and Aleve are the gold standard for arthritis, as well as Tylenol. So we use these medications first line of therapy. If the patient is not getting enough relief from this, then we can offer them injection therapy, which is a cortisone shot. And typically that's done under ultrasound or x-ray guidance in the hip joint because it's a deeper joint and we need to ensure that we've actually gotten the medicine in the joint. But unfortunately, this only works temporarily and usually only lasts about 6 weeks when the disease becomes severe enough. Also, offering them a cane to unload their joint can be helpful, but of course that's typically not an acceptable solution for a younger patient or a more active patient for a long-term outcome. So then we come to the surgical answers for this, and typically it's a hip replacement to resurface the joint that's been worn down from the arthritis. And I have an example here of an x-ray of a patient that has a normal hip on the left side with good preservation of their joint space, and a very arthritic hip on the right side where the bones are rubbing together. The body is forming osteophytes or bone spurs, and they're forming small cysts up into the bone, which is a sign of severe arthritis. And this patient elected to undergo a hip replacement, and this is what a typical hip replacement looks like. There's usually a titanium stem and a titanium cup placed in the bones, and then on the end of that there's a ball that can either be metal or ceramic, and there's a liner that goes inside of this socket, which is typically either plastic, ceramic, or less commonly now can be metal. We make the choice of what components the hip is made out of, whether we use ceramic on plastic or metal on plastic, or whether we use ceramic on ceramic, based on the patient's age and activity level. The most common combination of bearing surfaces now throughout the country is either a metal or ceramic ball on a plastic liner. And the technology in the plastics has improved dramatically over the last 10 years. So they're lasting longer, and it looks like in simulators now they're going to last at least 30 years. And they are not forming osteolysis, which was a big problem for the first generation plastics, where the plastic would wear out and the body would resorb the plastic particles, and the cells that were stimulated to do that would start resorbing the bone around the implants. So we had this big problem where the implants would become loose and people's hips would wear out, creating difficult revision problems for us. We're not seeing that quite as much anymore because of the newer technology, and it's very encouraging because it's allowing people to live longer without ever needing another operation. Ceramic on ceramic is still around and a popular choice for a very, very young patient, because that is a hard-on-hard bearing surface that can last over 30 years or forever, but it does have problems of squeaking and cracking that it can occur in small percentage at the time, so it's not something we use for everyone. Metal on metal is another option, but we found that there's a lot of complications from the metal wear debris, so this is a much less commonly used solution for patients now. Thank you.